Hi, I'm Dr. Johnny. Do you want to know the trick to getting natural looking beautiful lips with every injection you do? Join me today, we're going to talk about it. So we're talking lips today. I see it in my practice every day, and you see people coming in of an older generation who really want it done but are apprehensive about it, or had it done, didn't like where they went and had it done last, had a little bump or lump or created a bit of volume. And at the very end of the appointment, they'll say, but I think I want more lip filler. So all the genres are attracted to this. Why? Well, lips, I did a video, red lips are sexy. How to get picked up if you get red lips. We do lip artistry. We do the lip flip with PDO. There's a lot of interest in the lip. So it crosses genres, but mainly because it can be done relatively inexpensively. 1 or 2 vials of filler, and patients go home and they see the result. It's also going to be your number 2 call back to your clinic for unhappy patients with a lump, a bump, it looks unnatural, and it could be 3 hours after you injected it. But they might not like it with dynamic smile, or they might not like it at rest. So let's talk a little bit more about the lip filler and how do you get a great natural result. Remember, if you like these videos, click like, it helps build our community. Click subscribe below. That helps also build our community, and click the bell to be alerted. So when we have new videos that come up, you're alerted and you can be among the first to watch them. Thanks for joining my family here. We have a great group, we're learning. We have a lot of comments at the end of the videos. So read them so that you learn what other people are saying, they disagree or they agree with me and what their experiences are. But to get a natural lip filler, what we're talking about today is it's the #1 driver to practices now, along with Botox-like products, but it's also a high source of callbacks of unhappy patients, mainly because the lip isn't just static, it's dynamic. It stretches, it purses, and what I want to talk about in terms of getting a natural look, it's not just about the lip, but the perioral area. Keeping in mind, we got the lip and we have lip size, but what if it's downturned? That's not going to be a good looking lip no matter how you fill it. What if there's loose skin, peau d'orange on the chin? Then the lip isn't going to look perfect. And let's talk angles. If there's a hollow beneath the eyes, the nasojugal groove, or the fat pad has kind of grown above the nasolabial fold. We know now that fat doesn't necessarily sag, but it hypertrophies and atrophies, and we have all the complicated fat pads in the face. If that doesn't look good, putting a new lip on an old face, that's not going to look good. So there's many factors to it. There's also muscle movement. So think about it. That's why we're often injecting the mentalis, the DAOs, and we're doing filler around the toxin. So we're doing 6 units around the lip and 2 units on the levator labii, so that maybe the person doesn't have a gummy smile, because remember, the lip is intricately related to the jawbone and the smile. If people smile and there's no lower teeth or only lower teeth or just upper teeth, that may not be an appropriate lip filler, because it's going to change the smile and the dynamics. So the teeth are also important. This is complex stuff. So how do we get a natural looking lip? #1 is the consult. Always key to find out what the patient's looking at. You're going to be surprised. You think they're looking at the Cupid's bow when in fact they're looking at the edge of the mouth. You think they're looking at vertical lip lines when in fact they're looking at the vermilion border. On and on. Find out what they want. Beyond that, I think the most important thing is, when you think of the lips, it's really not the lips but the whole face. It has to look congruent, but at least consider the lower face, the chin projection, the nose to the chin, the AE line or Ricketts line. If the chin is deficient, no matter what you do in the lip, it's just not going to be a good look. If the mouth is turning down, consider injecting the DAO with neuromodulator. Just 3 units a side helps turn the edge of the lip up. Don't forget the modiolus. How can you do lip filler without injecting the modiolus? So the edge where the muscles come together at the edge of the mouth, It's, I think, a little more of an old school term. We used to use it all the time, but we call it the modiolus. But supporting that supports the edge of the mouth. That's important. And then it's about lip artistry. It's about injecting the old school way, kind of the wet dry border, the vermilion border, the Cupid's bow, and then considering the pillar technique or the tenting technique. Maybe a little bit of the droplet technique, depending on what you get. But the most important thing to consider to get a beautiful looking lip is the consult, switching techniques when you need to, thinking about all the angles I just talked about, and filling and rejuvenating the whole face, not just the lips. Certainly if everything looks perfect, you can go straight to the lips, but it's about the all-encompassing lower face. If there's loose skin, it can present an unusual problem sometimes because people don't know it when they move and talk and they're eating dinner and they're out in social situations. Especially females lose bone. You get loose skin down here. You can go to PlasmaSculpt.com. You might have other procedures, but you need a little bit of plumping of the natural fat, a little bit of tightening of the skin, but you don't want a lot of filler because people look unnatural. They won't be moving properly. Add too much toxin to the lower face and you're spelling disaster. So I like PlasmaSculpt and tightening, but you have to be very careful because you don't want to use Sculptra around concentric muscles for fear of nodules. So it's not something you just pick up and do, but have your method to tighten the skin, to take care of the angles, the folds, and the choice of lip filler finally. So choosing the right filler, generally speaking, it's hard to generalize, but the older demographic wants a softer filler, especially the first time. They don't want to feel a lump or bump. They don't want that projection, and you're going to probably have to address vertical lip lines. So a softer, more what they call elegant filler. And the first question you're going to get asked when you say, I'm going to use a softer filler, oh boy, it doesn't last as long. That's not necessarily true, but that's the first thing the patient is going to think. If it's softer, more elegant, oh, I want structure and support. No, there's a balance. So the choice of lip filler plays a big role. So at the end of the video here, go to the comments below. Let me know what's your experience. What do you like using for lip filler? Have you had lumps and bumps? You can watch my video on lumps and bumps as well if you want specific issues. Also my video on how to get red lips. Red lips are attractive. While filler can help make the lips red, something like PlasmaLip or other ways help. And remember, it's not all about filler because we can use PDO threads at the edge of the lip that doesn't draw water in, doesn't give a ducky look, but gives a nice lip flip with PDO threads. And you can watch my video on that. Let us know, what do you do to make a natural looking lip filler? Thanks for joining me. Keep your skin and body beautiful, healthy, and vibrant.